Pelvic ultrasound. This is one of the most common ultrasound exams that we get in the hospital or outpatient. This exam is being offered to females who have uterus and ovaries. Indication that requires a pelvic ultrasound would be if you have irregular bleeding all of a sudden, or if you're having pain, more pain than usual during your period, or if you have an IUD just placed and want us to check the location. Preparation is so important. If you are not sexually active, we can only look above your belly. Usually there's also a transvaginal part, but that's only if you are sexually active. We need you to have a really full bladder because we use the bladder as the window to look through your pelvic organs. Without the bladder, we will not be able to see anything. If your provider forgot to tell you that you have to fill up your bladder, just make sure you do, and don't go to the bathroom when you're waiting. The body takes time to move the fluid that you drink down to the bladder. Usually it takes at least 30-40 minutes. So if you didn't fill your bladder and you're trying to do it when you get to the appointment, it's not going to work. You're going to have to wait. In a transvaginal exam, we have to insert a probe inside of your vagina, and we will do it when your bladder is empty. Vaginal exam produce a much better, clearer pictures because we get to get really close to the pelvic organ inside of the vagina. If you are not sexually active or have never had a pelvic exam, we will not do this. Children and people who are not sexually active, we will have to do the transabdominal, means that we just scan on top of your belly with a full bladder. It does not matter if you're currently bleeding, we can still do the exam. Transvaginal is the best way to figure out why you're bleeding. You will usually feel a lot of pressure with the transvaginal exam. It shouldn't hurt. Some deep breath throughout the exam will help a lot to relax you. Okay, to sum it up, come to your appointment with a full bladder. Start drinking water a couple hours before your exam, or at least an hour, 16 ounces at least. If you have any more questions, let me know down below. I hope you found this helpful.